So hello guys, we'll be doing a quick video. Actually, I'm having tomorrow my shift in the hospital, and I thought I should be connecting with you guys and giving you more information about what is the process basically. So I just wanted to do a quick video because I have to do a learning on my IV competencies also. So I just thought I'll be spending some time with you guys and give you more information about the process, the whole process which it requires to be a registered nurse in London or anywhere in the UK or wherever. But currently, as I am working in London right now, so I'll be giving information about uh, basically all the scenarios, whether you are anywhere placed in each anywhere in the part of the England. So the NHS, National Health Service, is being is regulating the overall hospitals that are there in England and Northern Ireland. So this National Health Service regulates all the hospitals, and inside the hospital, all the protocols are basically conducted by the National Health Service. Apart from that, the Nursing and Midwifery Council, which is basically Nursing and Midwifery Council, which regulates all the nursing and midwiferys who are allocated in the area around the whole England and the Northern Ireland. So they this is the process basically is there are two separate bodies, NMC and NHS. So in case you want to become a uh, national health service staff nurse, then you have to apply on their official website basically. So when you are living abroad in another country or something like that, so you have to go through the whole process. And just good news, actually yesterday I just got my nursing and midwifery council official registration process. That was the NMC pin which I was waiting for so long, and I did my OSCE too. I cleared it in first attempt, all thanks to me. So the whole process has been completed already. I'm so much happy because I was just going through the whole process throughout the protocol, and it's finally done already. So I'm an official resident in the London area right now, and this accommodation is provided by one of the Imperial College London, basically the in which I'm working right now, the Imperial College London, and the employment basis. So getting on to the process, what is required for the process. So basically, when you want to become a NHS nurse in UK, in any part of the England, you just have to go through the process step by step. And for that, the first thing you need to have is whether you are in any country, you just require one nursing certificate that is being done by from your one of your colleges which provide this course. So there are a lot of colleges and universities also in India also, and wherever you can find, and you can opt for the course. And then after, it's like a 3 years course and 4 years course, then you have to complete it. And after completing that one, uh, in case you want to gain an experience, so that when you come here, everything will be new to you. So the people are most frustrated. So about nursing profession, it's not about just going because you really like this profession. It's really taking a heart into it, like you are really passionate about nursing, because taking care of the patient and providing the care to the patient, and making sure that everything should be all right for the patient, with their vital signs should be stable. And in whichever department you are, whether it's intensive care unit, and whether you are in the cardiac care unit or medical surgical ward, any of the hospital departments. So you just have to get through the whole experience basically. So it's not like you just want to jump because there are high opportunities and it's like that. in case you feel like really going into this thing, then you should opt for this thing, because there is a really lot of hard work. And as you get an experience, you will get a lot of hands on to the things like equipment and all, like ventilator and NIV, BiPAP and IABP. A lot of things are there in the hospital scenario. So uh, the first thing about getting your the certificate complete. After completing your certificate, as soon as you complete your certificate, you will getting your registration certificate. Through that, you can apply in any of the state you want to work on. Like I got my registration certificate from UP, so I have to transfer to Delhi. Then I can work in that area. Then in any of the state you can have this registration after completing your course. And then after, when your registration is done, then you can head on to the next part. This is like, just after clearing your course, you can directly apply here, because here in NHS in UK, England, you don't require any kind of experience. Earlier it was like 6 months, but now they are even considering the freshly passed out nurses. So it's not like you need any kind of experience, but for my side, it is recommended that you gain some experience, and then after you can apply as a smooth process. So the first process, just gain your degree, then after gain some experience, as of my recommendation. Otherwise, you can just go on, head on with the next part, that is, you can skip this part of gaining experience, and you can go on with the next part, that is known as getting an English proficiency certificate. So when you basically, in England, all of the people are speaking in English, so you can't expect someone is speaking in your language. So I've seen that most of the people used to come here and talking in their language, but it's not recommended. And it's like a back in all places it's like appreciated, but here people don't appreciate at all. When you type speaking in your language, they treat you like an alien. So also with the patient also, they are too much conscious of it, so you have to all the time talk in English. So English should be your priority. And when you think English, for you, when you have a good command in English, like your pronunciation, vocabulary, I'm not paraphrasing, whatever things comes on with this thing, whether when you have practiced a lot and you know that you can speak in English quite well, then you can go on with this English proficiency test. And there are several trainings also available. And in case you are confident enough, then as of my recommendation, you can prepare on your own, because this is what I did, because I was confident enough in have doing this examination on my own. And as you have seen my earlier videos, I was doing everything on my own. So I was just confused about the speaking part, because I just needed some confidence about the speaking part, because I was not having an idea about. So I just needed an interlocutor in front of me, so that I can have a more conversation about the speaking scenario and OET examination. So there are two examination, basically the IELTS and OET examination. When you're done with any of these, and gaining the required score, also there is more information that I want to give of the Nursing and Midwifery Council. They have reduced the score. This is a good opportunity from your side. And the clubbing of the score, in case you missed the point 0.5 score, something like that, in first part of your test, and you want to redo a test, and earlier it was like 6 months of duration, you can sit for the next examination, but it's like the the duration has been extended to 12 months. So in case you want to club two scores, basically, so first of the with the first scorecard and the second scorecard, there is like a 12 months of gap. So it's like quite good. Earlier it was 6 months only. And it is quite good news for you guys. So any of the examination, whether it's IELTS or OET, you gave one time examination, you're missing some scores, just opt out, just opt for the next scorecard, and you can give in the 12-month of period. And you can club your score, so it's good for you. And also in the whether it's OET or like IELTS examination, just choose one. So what is recommended from my side is like you can opt for OET examination, because it's quite uh, easier for us, because specifically for the healthcare professional, it's not like IELTS. In IELTS examination you have to give examination, you have to be in, it can come from each and every profession. Like I've given one time IELTS, and I was not able to get through because it was like economics is coming in that examination. And although it was kind of easier, but you have to put your brains into it. But although in case you have already studied about the things, like you have studied in nursing, and that is coming in your examination, English speaking examination, that is quite reasonable, because you can get through it easily, because you already had studied for it. So whether it's speaking part or the listening part, reading part or the writing part, all is the hospital scenario, you can find it in this one. And then after you can uh, gain your certificate. And when you get the required score, which is for the nursing and midwifery council, then you can go for head on with the next process. This is just the simple process getting on here in this UK. Just gain your nursing certificate. Then after OET examination, after clearing OET examination, just head on to the nursing agency, basically, because I've seen that people are talking about and spreading the rumors that agency used to take some money, and then they are like, but most of the agencies who are recruiting nurses from any part of the India or any part of the world, they are not taking any of the amount. Like for me, I didn't have to pay any of the amount, like it's what zero. And whatever I had paid my amount for the OD examination and other, like registration process, nursing and midwifery council part 1, like CBT examination, all those was refunded into my account when when I was going through my OSCE preparation program, and I landed here, like all of those was refunded in my account, like when my account was created. So I have to pay nil amounts. So when you find the agency, make sure it's like officially recognized, and also see the ratings, because there are a lot of agency and these are new. Those are new. When they contact you, and they will say like NHS interviews is going, they conduct for you. But when they are officially not recognized, there are chances that they back off, and that time you can have a lot of problems when you head on with the half of the process, and you have to do it once again. So you have to uh, think about the same, and go for some of the recommended agencies. From my side, the recommended agencies, you can opt for like Global Nurse Force, which I was recruited from. So it is a South Indian like agency, and it have a lot of branches all over the India. And apart from that, the Training Nursing Association of India, TNAI, that is also recommended, that is in Delhi, in the South Delhi part, that is in Green Park, I think. And apart from that, an EU professionals, and INSCOL, and there are a lot of agencies also have available here in London and in the whole UK. And in London, I was having collaboration of Global Nurse Force with Medax Healthcare. They were both collaborated, and they just um, placed me, and they were having a collaboration kind of, and they were just helping me throughout the process. Basically, I was having two agencies, so it was like that, one from the London and one from India. So when you find the proper agency, and when you head on to them, then you have to show them OT certificate. They will conduct an interview, they will schedule an interview date, and they will ask you whether in which city you want to apply for, like in the UK. So I opted first for Surrey. Then I was seeing a lot of videos and paper, and also I was thinking about London, basically, because this is kind of quite a good area, because all the availabilities and the transport, and so like London is London, like. So I always had a kind of in my mind that I want to opt for London. So when yeah, when I was taking this Surrey part of the England into consideration, I was also thinking about the London part, and then I opted for London also at the same time when I was applying for the. So I had two agencies, basically. It was kind of fun, going through the whole process. So And so I opted for Surrey also and the London. So London consortium interviews was going on, and then I opted for London consortium. Although half of the process was completed from Surrey side also, and National Health Service. So they were about to conduct my interview, and when they had taken all the documents or something like that. So I opted for London Consortium Trust, and when I was done with the interview, I got my offer letter from one of the Imperial College London, and I couldn't believe that. Like I would be placed in this part of the area in London with Imperial College London, one of the UK's topmost colleges. Like Cambridge and Oxford University. So anyways, that was my part. So apart for your part, you just pick up an agency and select in which part of the UK you want to go for. When you select the part you want to go for, Manchester, Nottingham, Northumbria, Northern Ireland, or London, or some, sorry, any place like Leicester, any part of the UK you want to apply for. When you select one of those, then after your interview will be conducted, and you have to prepare for the interview part. And then after clearing your interview, you will be getting your offer letter. And after getting your offer letter, they will be asking you to clear your first part of the uh, nursing and midwifery council process, that is known as CBT examination. So you have to also go through this computer based test. That is kind of easy. There is a recommendation from my side. There is a Telegram page known as Nurse Facts, NMC Nurse Facts, kind of name is that. In that you can ask for them to join, and when you join that, there is a lot of question usually happens. That people are a lot of all the members, usually there are more than 30 or like 40,000 members in this alone group. And people are consistently asking question from each and every. This is basically related to the computer based test. So when you head on to that page, you will be also getting those PDF file. There's like 1,000 question, and when you read each and every questions, after the reading and each and every question, when you do the examination, you will realize all of those questions basically were coming exactly same as in like computer based test. When you So it is kind of recommended, but this part is quite easier, the computer based test. And when you go on with the next part, after clearing your CBT examination, when you give your CBT examination result to the agency, then they will recognize that you can head on with the next part, that is um, getting your visa application process done. And it is also kind of long process. So basically just waiting for the visa, and it's quite desperate time. When you're waiting for your visa, and you have to go, in case you are living in Delhi, then you have to go for Nehru Place, and you have to go to the certain procedure. Anyways, you will get through that. It's quite easy. You just have your documents ready, and just head on with the visa application process. When your visa application is done, then after you have to send all of those documents to your agency, and they'll be contacting with the uh, in which hospital you are being placed. They will be contacting with the hospitals, and they will give you the certificate of sponsorship. So certificate of sponsorship is the main document, I would say, in the whole process, because it's kind of sponsorship that is being given by one of those National Health Service. So when you get this document, certificate of sponsorship, you will be having some kind of serial number. That is quite important, and that is basically the certificate of sponsorship number. Apart from that, one more serial number is there, and all the information is being given there. How much you will be working, and how much salary you will be getting, and till when your certificate of sponsorship is valid. And then after getting the certificate of sponsorship, it's also kind of wait. Like you have to wait for a quite longer period of time. So maybe it can be like because basically in UK the working days are like Monday to Friday, and weekends, in case you ask anything, they will reply nothing, like nothing. In the weekends, they are not people are not that much active as on from Monday to Friday. So when you are giving messages and you want to have some query, some kind of query, then you can ask for in from Monday to Friday, and you can ask for like when my certificate of sponsorship is about to come or not, something like that. And when you get your certificate of sponsorship, then after you have to uh, collect all the documents, and then after you have to give to your agency. They will forwarding to the recruiting manager, the one of your hospital. When they will be forwarding all the document to them, then they will confirm that you are finally done with your process, and they will be issuing one of the flight tickets basically, and it is also done from their side. So for the visa application process also, apart from the CBT examination and the OET examination and nursing midwifery council first and second part, something like that, so it includes certain steps. Nursing and midwifery council first part and the second part. In the first part is like a basic procedure and is like test of competence. Then you when you are done with test of competence, when in the nursing and midwifery second part, you'll be having uh, doctors physician declaration whether we are medically fit and fit to work in the UK. Then it is also done. Anyways, that was the earlier part. So when you are done with this part of your certificate sponsorship, then you will be getting your flight tickets. So each and every thing that you have paid for will be refunded after when you arrive here. So when you will be getting your flight tickets, you have to arrive here, and the accommodation for the first 3 months I was being provided, you also be getting. So when the offer letter is being provided, just read and each and everything, and just make sure you read each and everything, and make sure when you're signing, it's like a contract, so you have to make sure each and everything has been signed, and the document should be complete, and just go through the whole process, what amenities they are giving, what things are they are providing, something like that. So it's like a basic offer letter. So when you're done with your uh, the offer letter and the flight tickets and all, when you reach here, and then you'll be provided some kind of accommodation, and for the some part of the duration. So it's like whether it's 2 months, 1 month, or 3 months. So at that time you will be having, this is the part in the UK. So when you reach here, you will be having your OSCE training program in the starting. So in the OSCE training program, you will be having basically training for the OSCE examination. And in OSCE examination training is the test of competence second part. So you have to make sure you clear it in first attempt, because I've seen that uh, when people arrive here and they are not practicing well, they are giving examination once again, you know for me, lucky, I was being so lucky. um, when I was preparing for my examination, because we have to I was also having like a 4 years of experience back in India. So when I arrived here, I was going through my OSCE examination, uh, OSCE training. I knew what it was going on. It's like a basic, all the procedures, yes, that usually happen in the hospital scenario, whether it's like catheter specimen, a specimen of urine, and whether you are providing oxygen therapy, whether you are doing the nasogastric tube insertion, midstream urinalysis, and Braden score risk assessment. And there are like 21 skills you have to practice on. And apart from that, uh, the professional values and evidence-based practices there, and a PI station, that is for like assessment, planning, implementation, and evaluation. So these total 10 stations are there, and you have to practice when you arrive here, and you have to practice for these 10 stations for approximately around 1.5 month. Then your um, OSCE examination date is being commenced, and after clearing your OSCE examination, and if you are lucky, you can clear this in first attempt, like most of the people like me. And apart from that, in case you are not able to clear and you are left with like one or two stations something like that, then you have to do it once again, and you have to pay like 400 pounds more. So I flight from my examination center was in Northern London, Ireland. I traveled from here London Luton Airport to Derry. So it was like a long journey basically. So I took my flight from London Luton Airport. I landed in Belfast. Then I traveled via train to Derry, and it was beautiful journey. Like it was in Ulster examination center, Ulster University. So that place, Derry is like beautiful place, but part of my OSCE examination were kind of harsh. Like when I went there, the weather was kind of good, but later on the weather became bad when I was about to depart from there. It was like a storm was coming, and the storm was known as the news was saying like it's kind of Katrina storm, something like that. So it was kind of strong storm. And when I had to arrive fly back to London, so I have to reach Belfast once again. And from Derry, from Ulster University, when I was traveling back to Belfast, it was kind of strong weather. I reached there in night, and it was raining throughout the time, and wind was blowing harsh on my face. So I was just praying to the God that everything's gonna be all right. But everything you get through is reasonable. Like you are practicing hard, you're just going through everything, and when you put your heart into it, God listens, and they will do it. And by God's grace, I cleared it in first attempt. So it was good for me. Then after I was waiting for my Oscar result. At the same time, some of the student basically went with me, but went separate. Like I don't wanted to go with the group, and they are kind of having chattering on and around, so I don't like that thing. So I went separate, not with them. But I see most of them, like 15 of the member of group was there from us, and half of them are kind of left, and they are giving examination once again. They are going tomorrow and giving OSCE examination once again for just two station in the OSCE examination. So it is recommended, like when you're back in your home and when you're preparing for your CBT examination, so just go through your OSCE studying OSCE, just have an idea about the OSCE examination, basically what it's like. So that when you come here in UK, and when you are just wondering what it's like for the OSCE examination, it's like a practical examination. When you will be seeing for the first time, you will be like, oh my god, what is this? So it is recommended that you first uh, you prior on the prior basis, you get an idea about the OSCE examination. It is recommended from my side. It's not like a lot of people are just flying all the way from India or somewhere all over the world to here to become a NHS nurse, but it's not like a easy process. It's like a whole long process. And yeah, this was all about the whole thing. And make sure when you are just going through something, just when you start the race, you make sure you finish it. It's like that. So you have to go through the whole process. And this was all about OSCE examination. So for what my recommendation from you to you guys is, just when you're choosing this nursing profession, just don't go blindly just because of the people are doing, and you can do that too. In case you have passion, and you can in case you have in mind that you can do it too, then just go for it. Uh, otherwise, yeah, you can study also and get your hands on, and then after you can realize that you are good at it. So it's up to you, how you go on with the situation. So this is all about like whole process. And there are I think I've tried to explain as a part of my experience, like. And when you experience your own things, you will be realizing some of the things are missing, but these are kind of main things which I mentioned right now. And like getting a getting your certificate, then having your registration, then OET examination, getting on with the agency within interview part, and getting CBT part done, and NMC part first and two, and CBT, after CBT examination, sending all the documentation, and then after getting an offer letter, signing on offer letter, then you will be getting your um, uh, the certificate, the visa application process. Then after you will be getting your certificate sponsorship. Then after certificate of sponsorship, you will be getting your flight tickets also. Then after flight tickets, you will be traveling here in UK. And after traveling here in UK, you have to go on with the next part of the competence, that is known as OSCE examination. And after OSCE examination, you'll be getting your official NMC pin. So this was the whole process. Hope you like it. And will be I just want to do this quick video because basically to give you more information, because I just had completed my part the whole process, and I also got my NMC pin. So make sure you, when you come to the UK, and you should clear this OSCE examination in first attempt. You don't want to pay 400 pounds more. You know, like most of the guys are traveling back. I feel bad for them, but anyways, we are practicing. Um, I'm letting them know more of the procedure. So it's like the whole process. And after getting your NMC pen, it's like 3 years validity there. And each and every year, like there's some kind of fee, like 120 pounds you have to pay. So it's not a big deal anyways. So when you are living in UK, you are earning that much. And so best of luck with your process, guys. And we'll be doing more of the videos. And please like this video, like, share and subscribe, so that I can motivate you guys more, and do we can do more videos about the videos in detail, whatever you like. And you can comment also that you want to have more information about this sub part and this part, this part. I can do that video, but make sure you comment. So please like, share and subscribe, and see you next time. So good night, tada, take care, bye.